August means back to school. From kindergarten to college, students are stocking up on supplies to prepare them for the coming year. But as you shop for new shoes and notebooks, don't forget about your child's health. Be sure your child's immunizations are up to date. Most schools require proof of vaccination, so this should be at the top of your list. And while not required, a flu vaccine is highly recommended and is usually available before October, the start of the flu season. Check with your pediatrician. If your child plans to participate in sports, he or she will need a sports physical. These can be done at your pediatrician's office and at many standalone clinics. A sports physical doesn't take the place of an annual physical or well-child checkup with your child's doctor. A well-child checkup is a more comprehensive assessment of your child's overall health that should not be overlooked. And don't neglect vision and hearing screenings as well. This is often done by the schools, but your child's pediatrician will include it in their annual checkup. Check with your school for instructions if your child requires medication during the school day or access to medical devices like EpiPens. Do this before the first day so your child is protected against a medical emergency. Inform the school of any allergies or allergic reactions your child may have. If both parents work outside the home, have a contingency plan if your child is sick or becomes sick at school. Make sure your child is aware of it too. If you provide lunch or snacks, include healthy options. August is also a good time to review safety procedures, whether your children walk, bicycle, or ride a bus to school. And it's a great time to emphasize the importance of hand washing to prevent infection. Bullying can cause both physical and mental harm and impact academic performance. Equip your kids with the tools to identify and deal with bullying. If your child's sleep schedule is on summer hours, gradually move up their bedtime to meet the earlier demands of school days. Wean them away from screen time and into more physical activity. Active kids sleep better and are less stressed. And while you're shopping for that new backpack, select a lightweight one, preferably with a padded back and waist belt. It is recommended that your child carry no more than 10 to 15% of their body weight in a backpack. Heavier loads can cause back, neck, and shoulder pain. Students going away to school or college need to be prepared to handle their own minor medical needs. A first aid kit with instructions is a basic necessity. Provide a list of physician phone numbers and insurance information. This should include any in-network providers or university medical services. Set your child up with access to telemedicine services. This is a popular option among college students who can access a doctor anytime, days, nights, or weekends. Telemedicine doctors can diagnose, treat, and prescribe medications and typically cost less than an office visit. Most colleges and universities require full-time students to have health insurance. Be aware that many will automatically enroll students in the university's sponsored plan and charge them for premiums unless the student provides proof of insurance and obtains a waiver. Keep in mind that your student can stay on your health plan until age 26. Physical health and well-being play a big role in academic success. And August is a great time to put your child on a healthy path that lasts into the school year and beyond.